Back now with the troubling rise of a new drug making its way across the country, pink cocaine.
The mystery drug hitting the club scene with urgent warnings from the DEA and prosecutors tracking closely. Eyewitness News investigative reporter Dan Crowth has this story.
It's just as colorful as New York City's nightclub scene, but the narcotic cocktail could be dangerous, even deadly.
Well, I mean, it looks like cotton candy. You know, it may have that kind of appeal to somebody.
But there's nothing fluffy or sweet about it.
You have no idea what you're taking. The drug supply has never been more dangerous in this city.
It's called pink cocaine.
It's actually not cocaine.
In the cases the New York City Special Narcotics Prosecutor and DEA have seen, when it's lab tested, it actually has very little to no cocaine at all. Instead, a mixture of cheaper man-made drugs, from ketamine to ecstasy.
So the only ingredient that won't get you high is actually the food coloring.
That's right.
A mixture of dangerous uppers and downers.
When you see that mixture of your body being pulled in two directions, being amped up with a methamphetamine or a cocaine, and being sedated with something like ketamine, you know, that's a recipe for a terrible, terrible effect on the body.
The DEA says in some cases, the deadliest of drugs, fentanyl, is also getting mixed in.
This is 2 milligrams of what would be considered a lethal dose of fentanyl,
where even a tiny amount can be deadly.
They're mixing fentanyl in because they want to increase addiction. They want to increase their customer base. They want more people to come back and buy their drug. And it's something that every parent should be concerned about.
These drugs aren't being sold as you might think on street corners. Prosecutors say they busted a New York City woman this summer for selling pink cocaine on a messaging app through her cell phone.
Here's what authorities say was her menu of drugs for sale. She's accused of then shipping the drugs through the mail straight to customers.
You have this criminal underworld that has weaponized social media to push their poison to the far reaches of the United States and across the globe.
According to law enforcement sources, with the use of technology and social media, the mystery mixtures are easier to get than ever before, and there are more drug overdose deaths reported than ever before. The bottom line, they say, there's no longer any such thing as safe experimentation, no matter how colorful it might be.
And our thanks to investigative reporter Dan Crowth from WABC Eyewitness News here in New York for that. And we should note that the woman arrested for selling those drugs pleaded not guilty to the charges.
All right, let's bring in Dr. Darian now for more on this story. And let's talk about this lethal cocktail. You're talking about methamphetamine, which is an upper, ketamine, which is a downer, and mixed together, it can wreak havoc on your body.
Absolutely, and this is the problem. The majority of overdoses are associated with what we call in medicine polypharmacy. That's when someone is using more than one substance. Most often, believe it or not, it's alcohol. And many think because alcohol is legal, accessible, that it's something safe to use with these substances of abuse. But in many cases, alcohol can increase your risk of overdose and brain damage. So it's really important to pay attention to these substances. My job as a physician is not just warning people about the risk, but helping them reduce those risks. So doing these things safely, and the number one risk that creates a reason why people come into the ER is when things are combined or mixed.
Don't mix. I mean, you shouldn't do the illegal drugs in the first place.
Exactly.
But the other thing with these designer drugs that's really concerning is the fentanyl of it all. And just a tiny bit of fentanyl could kill somebody.
Enough, a small raindrop, a small amount of fentanyl can be lethal. And the problem also is that fentanyl can last in the system for a period of time. And so when you think that the symptoms are gone, patients can recur and then land themselves back in that dangerous situation. It's one of the reasons why we pay attention to educating people about what fentanyl overdose looks like. For example, if you notice that someone is unconscious, most importantly, if they have slowed or no breathing, if you're finding that they're not responsive to aggressive stimulation, if they have constricted or really, really small pupils or bluish lips or fingers, those are signs that they're not getting enough oxygen. They might be suffering from a fentanyl overdose. And that's why I think it's so important to understand how to use naloxone or Narcan. This is a reversal agent. It is a nasal spray, and one spray in a patient's nose can help to reverse and block those effects of Narcan. When you're using this, you can remember usually they come in a pack of 2, and that if the person doesn't have a response, you can wait 2 to 3 minutes and then use another dose. And then of course you're going to make sure that you're calling 911 regardless, even if they wake up and they say that they feel fine, because the symptoms can relapse and recur.
And again, how easy is it to use, and can anyone use it to save a life?
Anyone can use it, and I understand so many are fearful of it, but if you have any suspicion that someone who is unconscious and might be suffering from a fentanyl overdose, you can't go wrong with trying to use this. Many people are fearful that maybe they'll use it inappropriately. There are many times when I have patients who come into the emergency room after suspicion, we work them up and we realize that it wasn't, but it's still good to use this regardless because you don't want to miss those cases where this could save a life.
So this can't harm someone.
Exactly.
It's good to know.
Yeah, thank you very much. We appreciate it.
Of course.